Hi there, it's Amanda Vanderbrake again, VP of Client Services and Business Development with Camille Strickland, our Healthcare Client Services Director, and we're here today to talk to you a little bit about a conference we just recently went to. It was held in Evanston, and it was called the Healthcare New Media Conference, and just wanted to share some of our thoughts on it. So, Camille, what do you think was the biggest takeaway for you from the conference?
I think we talk a lot about all of the different things we're doing, both as hospitals and healthcare systems and agency partners. What was really nice to remind ourselves, is that patients and their interests are at the center of what we do with new media. And so thinking about ways that we can either engage them or add value is really what I took away from speaking with all of those different healthcare marketers.
Yeah. I think adding value is totally key, because if you're not already providing that sort of, patient-centered focus, you're already providing that relationship or starting that relationship in the care environment. If you don't have that, you can't succeed in social media.
Right.
But if you do, you can add and kind of, make it more visible and show those relationships that are happening in a very kind of meaningful and relational way. So, yeah, I totally agree. Adding value is key. It was really awesome to see some of the people that have attended our webinars and, are part of what we consider the EMG sort of healthcare community, actually present their case studies. So seeing how they're using social media to really move their message forward within their institutions, such as Boston Children's Hospital and, we also Nationwide. So that was really awesome to meet a lot of those people in person as well.
I wanted to add that I think a lot of times hospitals or healthcare systems often question, like, where should I start with social media? What's best for me? And I think to add to the point of patient-centered communication is the idea of, like, knowing your audience, understanding that the audience in the social media realm may not be the same audience all the time. They'll potentially become patients, but sometimes you're speaking to different people when you use different channels to deliver your message. So sort of getting to know who's in your social media space, what they want to know, and then using that information to craft messages that, again, tie back to adding value is really, really important. So.
Yeah, turning those channels not into just a new way to push out a message, but as a way to encourage feedback and get this feedback loop going. I think one of the sessions that you and I both really took away a lot from was the HIPAA and high-tech compliance conversation that was begun. So what were your thoughts on that specifically?
I really enjoyed Jessica from the University of Michigan Health System actually presented on patient privacy and social media. There is often a lot of concern from, I know, an administrative viewpoint about patient privacy, and rightfully so. We should be concerned about that. And I really liked what they are doing there in terms of the tools they provide to even their employees and how they train them to operate and understand their boundaries in that space, so that they can still be engaging and they can still do their jobs without coming in violation of any of these laws that we have in place for good reason. So I encourage any hospital or healthcare provider out there looking for great tools or just examples of tools that you can use to educate your patients and your employees to visit their website and check that out.
So overall, it was a really good conference for us. We actually, as our first year in attendance, the conference itself has only been going on for 3 years.
Yep.
So it was a lot of fresh ideas, a lot of knowledge being exchanged, and we really enjoyed that quite a bit, and we are excited to be part of it again next year. So anything else you'd like to add?
No, I encourage healthcare providers who get the opportunity to visit this conference to do it. Everything was very intimate and collaborative. I think the idea that people were able to sort of give their own viewpoints while presentations are going on also helped to add to the conversation. It felt very conversational, and I think that's very reflective of what's going on in terms of the conversation happening with healthcare marketers and social media topics. So again, I encourage everyone to try and attend next year, actually.
Yeah. All right, well, to wrap it up, just wanted to thank you guys for joining us again, and all of our talkabouts and this one too, as always, are posted on our Knowledge Center on visitemg.com. So we'll look forward to your visit there. Thank you so much.